Okay, are we live? I think we're live. I'm going to check my microphone and all that good stuff. So give me one quick minute, you guys. And if anybody comes on while I'm fiddling with this, let me know if you can hear me. So microphone, I think that it's working. I think it's working. So let's move that. I just have to move some things around on my screen. So what we're talking about today is feeling like you don't know anything, which is super, super common when you're brand new and it can be really demoralizing. So I'm going to wait till somebody pops in to let me know that you can hear me, and then I will get rolling. I just want to show my microphone window, but I can't find it. So I really have no idea if the microphone is working, but that's okay. We'll figure it out. Alrighty, let's dive into talking about this topic because I feel like it's so, so important, and it comes up all the time with students. It comes up all the time with new nurses. So I see somebody's on. Can you give me a thumbs up if you can hear me? I can't find my microphone controls to tell if I'm actually if my microphone's actually working. So the question that came up, and it was in my Facebook group, was how long does it take to feel comfortable as a new grad? And in this individual's instance, it was in the ICU. They'd been working for 2 weeks on orientation and feeling, in their words, stupid and anxious, which you are definitely not stupid, and not being able to give report well, not being able to do rounds well, all of those things, and just feeling really defeated at that time. So when you are a brand new nurse, when you are a brand new student, you really have to think about what the expectation is for your proficiency, right? There's a reason that your nursing school program taught you about Patricia Benner. Remember her? Patricia Benner, novice to expert. So what does that mean? That means that there is a continuum. There is a pathway that you are on as a student and as a new nurse, where you go through phases. You start out as a novice, and then you work your way up to being an expert. And to think that 2 weeks out of the gate, working in the ICU, working in a med-surg unit, working in a busy oncology unit, working in the ER, whatever it is, to think that 2 weeks in you should have your shiz figured out is a very unrealistic expectation for yourself. So if you find that you're kind of in the same boat, I want you to step back, give yourself a little bit of grace, give yourself a little bit of time, and realize you are probably right exactly where you need to be and where you're supposed to be. When you spend a lot of time, energy, and effort with this thought process that you're not where you need to be, you're using up all of your brain's processing capacity on worrying about that versus thinking about what you can do to actually progress. So let's pull this back a little bit. As a brand new nurse or as a nursing student, you're a novice. Maybe as a brand new nurse, you could possibly be an advanced beginner. When you're looking at Patricia Benner's novice to expert pathway, that would really be an extenuating circumstance where you had the most stellar clinical experiences, a ton of clinical hours, the best preceptor in the world, and you had just amazing experiences that were really ripe with learning. For the most part, you're going to be a novice. And you have to understand that you're going to feel like a novice for a while. You will eventually get out of that novice mode and go to advanced beginner, but don't try to rush yourself forward because you're not going to get there if you're just worrying about it all the time. So as a novice, as a brand new nurse, whether you're a nursing student in clinical or a new graduate nurse working on the floor or in the ICU, you have to accept where you are. And as a novice, you rely and thrive with very direct instructions and very direct supervision. So if you're not getting that very direct supervision, you need to ask for that. If you don't have very direct instructions, you need to seek those out. So for example, relying very heavily on policies and step-by-step instructions, that's going to help you. When you're looking at your time management, which is one of the things that new nurses and nursing students really, really struggle with, You have to come up with a system for your time management, okay? So what I recommend that you do is get a start of shift routine together. So get that start of shift routine together and start working on it, perfecting it, and utilizing it right away. And then with that, I want you to get adept at taking a report. Use a brain sheet. Don't just scribble some things down on a piece of paper. Have a formatted sheet so that you can keep your thoughts super, super organized and think through things in a systematic way. So using a brain sheet to get report, update it throughout the day, and then to give report, you basically just run through your brain sheet, right? It's not complicated. You just have to give yourself the tools in order to set yourself up for success to do it, right? So there's that. And then the other thing I recommend, and this is what I teach in Crucial Concepts Bootcamp, this is what I teach in my new grad program, Confident Nurse Academy, and that is to use a run sheet. Now, a run sheet is probably not something you're going to learn about in school. I never saw it. I feel like maybe I invented it. I don't know. I probably didn't, but I feel like it's something that I kind of came up with on my own as a new nurse. And on my run sheet, I basically kind of schedule out my day. Of course, it can change, right? Nursing is a very dynamic type of work. Things don't always go according to plan, but having a plan is a great place to start rather than feeling like you're winging it all day, right? So if you're interested in learning about a run sheet, I'll give you a quick breakdown, and then I believe I have a link that I can send. I'll put it in the description below. But basically what it is it has each of your patients like on a sheet of paper. Like say you've got a 8.5 by 11, turn it sideways. You've got each patient, you've got columns. On the left side of the column are your to-dos. Okay, for each patient, you've got 2 columns, a to-do list and a to-document list. So in the to-do list, say you've got meds at 9, noon, and 1400. Just write in those boxes, meds, 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 meds at 9, meds at noon, meds at 1400. Say you've got blood glucose checks. You're going to put those on there. You're going to put your turns, your ADLs, your lab draws, all those things that you need to get done in the day. You're going to fill out your run sheet as part of your start of shift routine. And it does not take long to do this, a minute or 2 per each patient. You're just going to quickly look at their orders, quickly look at their MAR, and jot these things down. Now you have a map. You wouldn't leave the house to go on a big road trip without any kind of directions, right? You might be one of those people that wants to veer along the way and stop and take in the sights. That's kind of what your day working as a nurse is, right? You start out with your map. You're going to veer off. You're going to see some different things along the way, but at least you have your roadmap, basically. So those are the things that I would suggest you do. First off, okay, let's recap. Stop feeling like you're going to be proficient after 2 weeks, okay? Unrealistic, absolutely unrealistic. You're wasting time, you're wasting energy, beating yourself up instead of thinking about solutions and ways to move forward and ways to embrace where you are right now in that novice to expert continuum. As a novice, again, lists, rely on processes, set up routines, rely on your routines. They're going to save you. Okay, so that's one. Second, make that start of shift routine. For me, it was things like looking at each patient, looking at their lab value, looking at their lab results, looking at what meds they have due, looking at the latest doctor's progress notes, and the last shift nursing notes. That was basically it. It would give me a good idea of the patient. And then part of that start of shift routine would be filling out that run sheet. You're also going to use a brain sheet to get report, and then you're going to update it throughout the day. Use that to give report, okay? So those are kind of the things that I wanted to address from this student, or not student, I guess, new nurse who was having a really tough time after 2 weeks in the ICU. Give yourself some grace. You're probably doing way better than you think you are. You are probably being your own worst critic. Take a breath, step back, regroup, do those things that I mentioned, and let me know if it helps. Okay? And thank you, Angela, for letting me know that you could hear me. I had no idea. I talked this whole time thinking, maybe no one can hear me. I'll do this later if they can't. So thank you. I appreciate you. And I'm hoping, I'm hoping to do these kind of answering your questions every week, and I'm aiming for Wednesdays around 3. We'll see how that works. Let me know in the comments if it works for you. Okay?